Welcome to Marian Ayurveda. In this episode, we are thinking about diabetes. Today, diabetes is a disease that most people are afraid of. However, in its treatment, diabetes is a disease from which many people have easily gotten results or have completely recovered. Once, about 2 or 3 years ago, while I was practicing, a patient was brought to me from Thrissur. Their fasting blood sugar was 650. They were also taking about 100 units of insulin. When they came to see me, they couldn't even walk. They had to be supported to come in. So she was brought in, supported by others. She was bedridden, a patient, a woman, a thin woman. She didn't really eat much food either. So when I examined her and administered our small doses of medicine, her blood sugar, which was at 650 fasting and wouldn't come down despite taking hundreds of units, dropped very quickly. In this episode, we are thinking about why this sugar or diabetes, type 2 diabetes, occurs. I would like to explain in this episode one of the reasons for it, a reason that no one has told us about yet. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. In this episode, first, I would like to invite you to listen to a couple of truly inspiring testimonials from people who came here and were successfully cured. Among them, the first one, well, actually, both of these individuals are patients who achieved a full recovery after finally addressing the two most important underlying reasons for their condition. It is important to note that they never actually came here specifically seeking diabetes treatment in the first place. The first patient came for a condition called fistula. While taking the case history during our conversation, they mentioned they have high diabetes. That is, it would be around 400. They were a diabetic patient whose fasting levels would reach up to 400. So I told them that the cause of your fistula and your diabetes is the same. Therefore, while treating the fistula, there is a possibility that the diabetes will also be cured. That is how that patient came to us. We treated that patient's fistula. Within 2 or 3 weeks, the fistula healed completely. Along with that, the diabetes, which was at 400, came down to around 100 to 120. It will come up in their sharing. Let's listen to it. It was during Onam, after having payasam, a sweet dish. They checked again, and it had come down to around 100, even lower. We can hear about that experience now. In this individual, what we tried to correct was their digestion. Yes, this person has heavy indigestion. It was because the food they ate was not getting digested that this person developed diabetes. And it is also as a part of that same issue that they developed a fistula. So what we tried to correct here was just one thing, strengthening their digestive system. By doing that alone, we automatically corrected both of these conditions. Even the diabetes, which hadn't improved despite all the medication they had taken, was corrected without us even treating it directly, just by treating the other condition. What I said is that it is often very easy for us to treat diabetes. Let's move on to this person's sharing. With me is Anish Kumar from Kannur. You came here first for a fistula, right? It was for a fistula problem, wasn't it? What kind of trouble were you having with the fistula?
When it comes to the fistula, I actually had a very painful abscess develop right near the anal area. I didn't know it was a fistula. When I showed it to a doctor in Kannur, I had an operation done there. A month after the operation, because I didn't know what it was or anything about fistulas, I developed a persistent fever. When I showed it to that doctor, the doctor told me to get another scan done, and that's when they told me it was a fistula. They said it needed to be operated on, but I wasn't interested in another operation since I had already gone through one. But I came here after watching your video on YouTube, sir. I have been taking medicine here for about 3 months. However, I can also tell you about another benefit of taking the medicine. My fasting sugar level used to be between 250 and 280 when I was taking English medicine. So because of taking this treatment for the fistula, my sugar is now staying in the 110 range. I drank 3 glasses of payasam one day, and when I tested it the next morning, my sugar was 110.
The payasam you drank during Onam?
Yes, during that time. The next morning, my sugar was 110. My sugar is normal now. Overall, I am very happy.
We just heard a sharing from an individual. So what I was saying is the first reason for what we call diabetes is indigestion. The main dietary habit that caused diabetes in this person is eating peanuts. Peanuts are very difficult to digest. By avoiding peanuts, or rather by avoiding such foods that are difficult to digest, this diabetes decreased significantly. Now the next person, when we go into this sharing, this person's main problem is a cough. They say they haven't slept for 6 months. They can only sleep while sitting up. They can't sleep at all if they lie down. So that's because of increased acidity. To be honest, it's a cough caused by acidity. So let's listen to this person's sharing. When we gave them medicine to manage acidity on the very first day, they were able to sleep lying down that same first day.
I am Gracie Francis. I come from Chirakkakkode. I am a diabetic patient. Along with that, I had a cough and couldn't sleep. I couldn't do anything. I had seen a doctor and taken both allopathy and Ayurveda medicines. Even then, I didn't get any relief. I used to sleep sitting up on this settee, leaning against pillows. I wasn't able to sleep. Whenever I lay down, I would cough. In such a difficult state, it was my friend Sony who suggested I come here. I came here and the sir gave me 2 types of kashayam herbal decoction. I took it. That very night I slept peacefully. It's only been a month, maybe a month and a half now. By then, my cough had reduced and gone away completely. Along with that, my diabetes, which was over 200, came down to 94. Now, whenever I check my diabetes, it stays between 94 and 120. It has reduced significantly. The doctor said it was acidity, and that when I take the medicine for it, my diabetes will definitely decrease, my sugar will drop, and it will become normal. Just as they said, my sugar has become normal. I am extremely happy. I was in a state where I couldn't sleep, but now I can sleep well, and I can walk properly without any major fatigue or tiredness. I am able to do my work well. I am very happy about that.
So what we need to understand is that the 2 fundamental and important conditions of diabetes could be indigestion and acidity. For very few people, both of these might occur in combination. So what we need to pay attention to is that rather than just taking diabetes medication to lower blood sugar, it is better to find the root cause and try to understand why this person developed diabetes and what kind of diet led to it. In our previous Marian Ayurveda episode, a lady shared her experience after suffering from diabetic neuropathy. In that, she was saying that she used to be afraid of eating rice, thinking that eating rice would increase her sugar levels, but that person also had severe acidity issues. Once the acidity was managed, the diabetes decreased and the diabetic neuropathy went away. She says that she eats rice well now. We often have a fear about rice these days, whether eating rice will increase sugar levels. But for these individuals, what we see in common now is that even though they are eating rice, payasam, dessert, and sweets much better than they used to, even more than when their diabetes was high, their sugar levels are still decreasing. Because once the system in our body that controls sugar starts working properly, we have a system that stores excess sugar in our body without letting it enter the blood. It is when everything goes into the blood, when the sugar goes into the blood, that it turns into sugar, or it turns into diabetes. So when we correct this mechanism, this metabolic error, we can easily control this diabetes. Or for many people, it can be completely cured to a certain extent. For many others, it is a matter of management. I mentioned earlier about a person who came in with a fasting blood sugar level of 650. By the end of our treatment for that person, we were able to bring someone who was taking 100 units of insulin down to 10 units, and their fasting blood sugar was brought down to 100. It came down from 600 to 100. At the same time, we couldn't eliminate those 10 units. What I was trying to say is that it might not be possible to completely cure everyone. At the same time, we can completely reverse diabetes in at least 50 to 70% of individuals just by correcting their digestive system. See you again in another episode. Thank you.